I'm Dr. Katie Benson. I am the owner and chiropractor at Advanced Spinal Health and Wellness. And I am very excited to be your chiropractor and to help you get amazing results with your health. And I thank you for taking the time to watch this video for your health or your loved one's health. The information that I'm going to share with you is going to be vital to helping you get the best changes, the best results with your health. And normally I would cover this with you in the office before I would go over your exams and x-rays. But watching this at home is going to save you time in the office. But what I'm going to share with you is going to really help you to see your x-rays, to know exactly what a normal and an abnormal spine looks like. So when you see your x-rays, you fully understand where your problems are, how that's affecting your body. And then most importantly, I'm going to go through how to get the best changes, how to get the best results, how to truly correct these issues. And that is what I'm passionate about. I have been serving our patients in our Marysville office for going on 17 years. And I've been blessed to have one of the largest chiropractic wellness offices in all of Central Ohio. I have helped thousands and thousands of patients over the years. And every day in my office, I get to help patients get out of chronic pain, get rid of their headaches, get rid of their back pain, get them back to doing the level of activities and quality of life that they want to have. Every day, I love to help patients get back to golfing, get back to playing pickleball, being able to pick up their kids or play with their grandkids, or even just being able to work around your house, your yard, do your job, and not have to worry about being in pain is absolutely something that I love to see my patients and help them achieve that. So it is important to understand how we're going to work with your body to truly get to the root cause of your problems and to get your body better from the inside out. That is very different than going to your medical doctor and going there with your back pain, your neck pain, your headaches. What we see happening with that type of system is that you never truly get healthy. You're just covering up your symptoms. And you get on more pills and more drugs with more problems, more side effects. And I know that you may have gone through that already, or you've seen family members go through that. I know I have. I am passionate about getting people healthy because I saw in my own family what happened with my grandparents and how that affected their life and their quality of life. And I grew up in a small town north of here. It's called Mount Victory. And my family, they're all farmers. And I watch my family work hard their whole life. And by the time they got to be my grandparents by their mid 60s, and they should have been able to enjoy the fruits of their labor, do whatever they wanted to do, we saw their health deteriorate. And it was like every time they went to that medical doctor, they got put on blood pressure pills, then cholesterol meds, then diabetes meds. Then they got put on arthritis pain medication with more and more side effects, more and more problems. And my grandma with chronic back pain going that medical route, all that was given to her was muscle relaxers, pain pills, nerve injections, cortisone shots. And eventually over the years, as her back got worse because it wasn't being fixed, it was just being covered up. Then she ended up having a back surgery that completely ruined her mobility, her independence, and she spent the last 8 years of her life in assisted living to where she was alive, but she had no quality of life to be able to do the things that she wanted to do. So when it comes to your health, I want to make sure that you don't go down that road. Is that I want to make sure that if you want to get healthier as you get older and you don't want to end up taking all these drugs and going down that kind of medical route, I want to show you how you can work with your body to truly get your body healthy. And to do that, you first and foremost have to understand what controls all the health, what controls all the healing in your body. One misconception about health is that people think that they're healthy if they feel good or if they look good. The main problem with that is that you can look great and you can feel great, and a day later you could drop dead of a heart attack, or you could find out that you have a stage 3 cancer diagnosis. All the top killers in our country, heart disease, cancer, diabetes, even Alzheimer's, you do not feel those things developing in your body. So that becomes a major problem when most people judge their health based on if they look good, they feel good, they must be healthy. but that is not the case. True health is when your body's functioning and healing at 100%. If your body's functioning at 100% and healing itself at 100%, you would never go from that to the next day dying of a heart attack or dropping, or finding out you have stage 3 cancer. So when it comes to getting healthy, we really have to look at what controls all function of your body, what controls all healing of your body. And when we look at that, the main thing that runs everything in your body is your nervous system. When you look at this slide, you can see at the top of our nervous system is our brain. That is where the program, the power, the life, the energy that runs your body is all in your brain. And for anything to work in your body, whether that's your heart to be able to beat, or your lungs to be able to breathe, or your bowels to be able to digest properly and not have constipation or acid reflux or digestive issues, it is your brain that runs all your organs. And it even controls all of your muscles, all of your tissue, all of your joints. It connects and runs everything in your body. From the moment you are conceived till the day you take your last breath, your nervous system controls all health, all healing, all function in your body. So we look at this picture. This is of a developing baby. And we look at the picture. Not much is developed in this little baby yet, but you see the brain is the first organ that develops in our body. And then what happens is that once the brain starts to develop, it shoots off a spinal cord that starts to grow and wrap around. And what happens is that out of that spinal cord, all of these little nerve roots start to come out of that spinal cord. And that intelligence, that life that's in the nervous system actually starts to build your body. And I think that that is pretty amazing when we think about that, is that there's this power, there's this energy inside of our nervous system, this intelligence that knows how to combine cells together and how to make those cells into a heart, and how to make other cells into lungs, and how to make other cells into your bowel, and how to put them in the right parts of your body, how to connect them all together, and how to not leave out even the tiniest detail as eyelashes and fingernails. And that we go from two cells that come together, that within 9 months, we have 76 trillion plus cells that form a perfect human being that is fully capable of life. And that's amazing. And that is the power that is in your nervous system. So when we look at your body and your nervous system, the main reason why I take care of your spine in our office is that your spine is designed to protect your nervous system. And your spine is designed to be in a position that allows proper communication from your brain to your body without any damage or any interference on your nerves. So when we look at a spine, a normal spine from the front should be absolutely straight. And from the side, your spine is actually meant to have curves. You should have a nice arc in your neck. It should be a 45-degree curve. I'm going to talk about that in a little bit. But if you look at your spine, if it's meant to be straight to protect all your nerves that flow through there, and your spinal cord is meant to be straight, if we look at your x-rays and we see your spine looks like this, you can see that will also start to curve your spinal cord that runs inside of your bones, and that damages your nerves that flow off your neck. So if that's happening on your spine and on your x-ray, that can be damaging the nerves that go in your neck, and that can be why you're having chronic neck pain. That can also pinch all the nerves that become your brachial plexus, and those are your nerves that control your arm and your hand. So if you're having things like numbness, tingling, loss of strength, then those nerves are being pinched off your neck going into your arm and your hand. But that can also start to affect all the nerves that flow off in that area. So if your nerves are being pinched in your neck, that can affect the nerves that go into your thyroid, your heart, your lungs, up into your head. And understanding how your body works, if I were to take that nerve to the heart and we were to cut that nerve right there, that would disconnect the nerve in your heart going to your brain. And what do you think would happen to your heart? Your heart would stop. And it wouldn't matter how many blood pressure pills you may or may not be taking or how good of shape you were in. If you cut that nerve, that disconnects the organ from your brain, and that organ will shut down. The nervous system runs everything, and your spine is designed to keep all the nerves free and clear and open that flow out to those organs and those parts of your body. If you're having issues with your body and your lower back, maybe when we look at your x-rays with your pelvis and your hips, instead of your spine being straight, you may see one hip that's higher or your spine is curving, and that's damaging your nerves that come out of your lower back. That can be a reason why you have back pain. That can pinch the nerves down your leg and be causing your sciatica. But that also affects the nerves that go to your hips, that go to your knees. And when we look at the picture in the lower back, these are all your nerves that go to your bowels, your bladder, your stomach, prostate, reproductive, the whole lower half of the body. So I have worked with enough patients over the years that we see the connection. There's a connection to your spine and your nerves and the health of the rest of your body. So I see patients that have had problems in their lower back, pinching these nerves off their lower back. And that's been there for long enough that that starts to spread out and be affecting constipation, diarrhea, irritable bowel, or bladder control problems. Or off the neck, that affects the nerves that go to their heart and their lungs. And it's causing their heart to have to work harder and raising the blood pressure or causing trouble with breathing, asthma issues. Is that the body is connected through the nervous system, and the spine is designed to protect all of those nerves. So your spine, when we look at the x-ray, there's two big things that you have to see on your x-ray. A normal spine should look like this. This is your neck taken from the side, your x-ray right from the side, and it's meant to have a 45-degree curve, this nice arc in the neck. It should look like a backward shaped C is what the normal x-ray should look like. The red line is the center of your skull, and you want that line to drop right in line with your spine. And that means that your head is on top of your spine and that it is not putting extra stress or pressure on top of your spine and your nervous system. What runs right along this curve in your neck is your vagus nerve. When you look at your vagus nerve, that is one of the biggest nerves in your body. It is one of the most important nerves in your body. If you were to cut your vagal nerve, your body would die. It regulates your heart rate, your respiration, your digestion, your sleep cycles. It controls whether your body's in fight or flight or whether it can relax and get back in a healing state. So when this nice curve is in your neck, your vagal nerve is nice and relaxed and it's happy and there's no irritation, no tension on it. If we go over your x-rays and you see your neck is straight, you've lost that nice curve, or your spine, instead of being straight from the front, is curving to the side, that's going to create stress on your vagal nerve. And when that nerve is stressed, it affects your brain's ability to send the signals and control all of these internal organs in your body. So we've seen this with patients is that when that nerve is stressed, it increases anxiety. It affects your sleep cycles. It will increase your heart rate and your blood pressure. It's making your body feel like on the inside, it's being chased by a lion and it's gone into sympathetic, which is your fight or flight nervous system, and not in your parasympathetic, which is your calm, your healing, your normal rest, digest nervous system. So this nerve right here is the reason why, as I start adjusting you and we start correcting your spine and getting your vagal nerve to relax, we will see patients that within your first month, not only will your headaches be, so much better, your back pain will be so much better, you'll start to notice things like you'll be sleeping better, you'll be able to breathe better, your digestion gets better, your energy, your mood gets better. And that has to do with your vagal nerve in that area. To think about your nervous system and how sensitive it is, if you guys remember Christopher Reeves, he was the guy that played Superman and perfectly healthy guy, like a specimen of amazing health. Yet when he fell off his horse, he broke his neck. and he broke the very top vertebrae, which is called our C1, and it slid forward and it pushed right into his spinal cord, like right at the base of the skull. And as soon as it pushed into his spinal cord, he was paralyzed. He lost all function, arms and legs. He had to be in a machine to keep him breathing, a machine to keep his heart beating. And after that accident, he did not lose the power or the intelligence in his brain, and his organs still had all the ability to work. But what he did is that when he damaged his spinal cord, that disconnected his brain from his body, and nothing was communicating, nothing was functioning or healing properly because that disconnect in the brain and the body. The way that we understand that with chiropractic in your spine is what we call the safety pin cycle. And this is a very important idea to understand about your health, is that your nervous system is designed to be a feedback loop. Your brain is always talking to your body, and your body always talking back to your brain, and it's fully connected. In that state, like that first safety pin where your brain and your body are connected and all your nerves off your nervous system are free and clear, allowing your brain and your body to communicate, your body works with ease. If you eat better, you get healthier. If you exercise, you get healthier. If you work on your mindset, you get healthier because everything on the inside of your body is working as it should. When your spine is out of alignment, your nervous system and your brain and your body connection becomes like this. Where now when you're misaligned, like that picture shows here, where your spine is shifting and it causes stress on your nerves, that's going to disconnect the brain from the body. And when you're out of alignment and these nerves are being pinched that are trying to flow from your brain to that part of your body, that's going to create dis-ease or stress on your nervous system. That is what we work on fixing with chiropractic. Every time you get your adjustment in the office, every time we adjust you, and I work on finding those areas where you're out of alignment, and we adjust that with your chiropractic adjustment, we open up the nerves. It's like on the inside of your body, that's reconnecting that safety pin and getting your body back in sync and functioning the way that it should from the inside out. And then your body is fully able to heal itself because everything's connected, everything's working with ease. So when we look at a normal spine, these are cross sections of a real human body, of a cadaver. And they've taken the spine and they have cut that spine in half, and we're looking inside your spine. So the normal neck should have this nice curve. And on the inside, this white thing that travels right through here, that is your spinal cord. Your spinal cord is the main lifeline. If you sever your spinal cord here, you would die. That would disconnect brain from body. Up here is your brain. Everything flows through this nice curve in the neck, that nice cord. The black is your vertebrae. The white is your intervertebral disc, the cushion between your bones. This is normal. This is not normal. This is a major problem. If you lose the curve in your neck and you see the spine straightening, it will pull your spinal cord straight. Do me a favor and hold your hand with a nice C shape. And then now I want you to straighten it as much as you can. And when you do that, you will feel pulling and tightness into your hand. That is what that does to your spinal cord. Is it pulls and it stretches and it almost starts to squeeze and strangle the spinal cord. That is what's carrying life to your body. You do not want there to be tension, tightness, squeezing pressure on your spinal cord. Phases of arthritis. If you don't fix issues in your spine, they will progress the longer they're left there. Issues in the spine, problems in the spine, by nature, are a progressive disease. That if you're not working on getting it better and you leave it there 5 weeks, 6 months, a year, it's not going to get better. It's going to keep progressing down these phases of degeneration. Phase 2 of degeneration is where you'll actually start to see, instead of having a nice cushion right here, you'll start to see where the disc actually starts to compress and bulge. So if you look at that picture, you'll see right at this level 4, the disc starts to bulge back into the spinal cord and starts to wear out. When you get to phase 3 of arthritis, your cushions are hardly existent and they're starting to wear out and create bone spurs and arthritis in that area. That is not the way that you want your spine to be heading down. The main reason why you have this cushion between your bones, the disc, is because it's meant to keep the hole open where your nerve comes out, to where there's no pressure on that nerve and that opening is nice and healthy. So that nice curve in the neck is meant to keep all the weight back on your joints. And that's meant to keep the cushion, which is your disc between your bones, nice and open, so the hole stays open where your nerve comes out. So if you lose normal position and your spine goes forward or it goes to the side, that creates damage on your nerves in that area. And the more that wears out, the more the hole where the nerve exits gets smaller and smaller, and it starts to choke off the nerves even more in those areas. So when we look at the spine, this is the main area that when we see that, the spine here, that we want to see the spine being in the good position and not progressing down these phases of arthritis. So when we look at the next picture here, this is one of my patients. This is my patient, Robin. I want to take some time going over her x-rays to really help you understand your x-rays when you see them. So when we look at her first neck x-ray here, this is her picture that we did when she first came in my office. And we grabbed her x-ray. And this is where we see a major problem. She should have the nice arc coming back in her neck, and her neck is reversing the opposite direction. And that's pulling her spinal cord. It's pinching all the nerves off her neck. And then her headline, this red line, is sitting out in front of her spine about 2 inches, which equates to her head feeling 20 pounds extra pressure for every inch that it has gone forward. Now it's 10 pounds of pressure. Her head now feels like 20 pounds of pressure. It is no wonder why when Robin came into my clinic, she had daily headaches, and multiple times a week she was suffering with migraines. She had chronic neck pain into her neck and shoulders, and she was getting numbness and tingling, losing strength into her fingers. She had anxiety, she had depression, she had acid reflux, high blood pressure, chronic digestive issues. And in her early 40s, she was miserable. And she is a babysitter, and multiple times a day, she would have to take medication. She was on 8 prescription drugs every single day. And when the kids left, she'd spend every afternoon after the kids left laying on the couch, miserable, having to take a nap because she was just exhausted and felt horrible. And when Robin came into my office, she was referred in by one of my patients, and they took her kids to her. And the thing with her spine is that when I showed her x-ray, she was ticked off because she had been to chiropractors for over 10 years. She had been getting adjusted. So when she saw how bad her spine looked, she was really upset because she wondered, well, I've been getting adjusted for years at a chiropractor. Why don't I have a curve in my neck? Why does my neck still look this bad? And I know that that may be the same for you. A lot of the patients that I take care of, they have been to chiropractors. They've been getting adjusted for years, and yet you're still having issues. Problems are still there, and they're not being corrected. And same for my patient here. And the reason is that with her spine was stuck in that bad position. So when your spine is in the bad position and you adjust it, you move it back, but then your muscles want to pull it right back to where it's been stuck a long time. So she was going to her old chiropractor maybe once a month, maybe once every couple months. She would get an adjustment. It would temporarily help a little bit of the pain, but it wasn't fixing it. Like, her spine was continuing to get worse, to the point that her numbness was so bad in her hands, her old chiropractor referred her to an orthopedic surgeon, and they did an MRI. They saw a bulging disc, And they told her that her next step was have a surgery where they were going to cut her neck from the front, fuse her vertebrae together with screws and plates. It was going to be a $90,000 neck surgery, and that they were giving her no guarantees long term how that would affect her body and her health. And she didn't want to go that route. Thank God she came into our office and I started working with her. This second picture is her x-ray that I did in the office after 1 month of care. We retook her x-ray. A lot of you, if you've ever been to traditional chiropractic, they focus more on pain relief. They're not focusing on correcting your spine. So a lot of patients will go to traditional chiropractic and they've never, number one, had an x-ray, or number two, the chiropractor never did a follow-up x-ray after care to show you how the spine is being corrected. And most times that doesn't happen because the spine was never corrected. You were just operating in the realm of a little bit of an adjustment to alleviate a little bit of the symptom temporarily, but not fixing it. So after a month of corrective care in our clinic, we retook her x-ray and she's up to a positive 21 degrees in her neck curve. That is amazing. When you fix your spine, you help the nerves to be healthier, and that helps your body to function better. The structure of your spine affects the health of your body. So when you think about your body, if you can take your spine and take it from this position where it's putting constant stress on the nerves and damaging the nerves, and you can take 15 to 20 degrees of pressure off your spine and open up all your nerves, your body's going to feel better. Your body's going to function better. And that's what we've seen with Kelly, is that within that first month, she went from having headaches every day to having headaches maybe once or twice in that first month. She did not have any migraines in her first month once we started fixing her spine. She started getting relief on the numbness and tingling into her hands as well. And we kept treating her. On average, my patients go through a corrective chiropractic care. It is like the braces part of fixing crooked teeth. It is the corrective part of fixing your damaged spine. And what we see gets best results is I typically will see patients 3 times a week for about your first 8 weeks. And then I will taper down to 2 adjustments a week for your next 8 weeks. So around 4 months of corrective care, but we're seeing better results and better changes for your health than what patients doing traditional chiropractic will never see. So this is her x-ray that I did after 4 months of care. We got her neck curve up to a 28 degrees. What that represents is her spinal cord is relaxed. The nerves are open that flow to her heart, flow to her lungs, flow to her neck, shoulder, her hands, her head. We've taken all that tightness and tension off the nerves, getting her brain and her body back in better balance in her system there. And at that 4-month marker with Robin, numbness, tingling was gone. She had full grip strength back into her hands. She never had to have that neck surgery, and that bulging disc pulled back in, and her body was able to heal that. We also helped her with getting off of blood pressure meds, anxiety, antidepressants, getting her body healthy. She went to her medical doctor and was able to get off of those. As a chiropractor, I'm not allowed to, help you get off your medication. But what we can do is we can get your body functioning better. We can get it healing better. We can get your nervous system free and clear. And then if you have goals to get off the drugs, you can work with your doctor to get off those medications to truly get healthy and to get your body better. And that's what I love to do with Kelly. She went from being a patient that was miserable, that we got her to where she could work out. She felt like exercising again because she wasn't in pain. She felt good again. So she started improving her nutrition, and she lost over 80 pounds in a year and started to see her whole life transform. And what I love about it with Kelly is that now I take care of her. I still take care of her. She has been a patient in my office now for over 14 years. I've been taking care of her. And she went from being a patient that was miserable and on tons of drugs, to where now she's healthy. And now she's in her, almost her mid 50s. She can be a healthy grandma. She takes no drugs. She feels amazing. She works out every day. And her quality of life is on a track to be getting better as she gets older, and she can do what she wants to do as opposed to ending up miserable. So, same thing for you is that when we see your x rays, you really have a decision to make. It's like, what path do you want to go down? It's your choice. You can choose to leave your issues there and let them get worse and go down the road of just living with it, covering it up with drugs, and eventually, as it progresses down these phases of arthritis, dealing with the more severe problems that come down the road with your health. Or we can choose to fix it, get it better, reverse that damage, and actually get your body healthy and get it healing. But it does require commitment on time commitment with your adjustments. Your normal visit in our office takes about 20 to 30 minutes for a normal adjustment. So we try to schedule best days, best times to make sure you can get in conveniently, get your adjustment, and be making progress with your correction and with your care. The next x-ray I'm going to go over, this is the lower back. These are your hip bones right through here, and then your lower spine and your ribs at the top. So here you want your spine to be straight, like right where that red line is, and you'd want your hips to be level. So you can see on my patient here, her hip is high and her spine is curving to the side. She has a 12-degree curve in her lower back. What that curve is doing in her spine is that is pinching all of her nerves as her spine curves. It's pinching all of the nerves that go off her lower back and go into her back, down her leg, and that whole part of her spine. And no wonder she had back pain and she had sciatica. And she would try to walk, she tried to exercise, and she was miserable. That pain was kind of unrelenting down her leg. With my patient here, same thing with her is that she had been to chiropractors. She'd actually been to two of them, and they didn't fix it. Just temporary relief, but the problem always came back. She'd done physical therapy and she'd done nerve injections, cortisone shots, but none of it was fixing her spine. So we started with corrective care. We started seeing her 3 times a week for about her first 8 weeks. And we went from a 12-degree curvature in her spine right here, and we reduced that down to 4 degrees. And within the next 8 weeks, we were able to get that almost perfect straight. And as we opened up those nerves, her body started feeling better. We really fixed that root cause of that back pain and that sciatica, and her body started healing and it started functioning and feeling great with that too. So for you with your body, my goal is that we can work on getting best results. Not only do I want to help you get out of pain, but I truly want to fix your spine and get it functioning the best it can and make sure you're not heading down the road of worsening problems with your x-ray, with your spine, and with your health. So with our care, what I typically map out is that corrective care. I think of it like it's like braces for crooked teeth. The corrective care is for straightening your spine, and each adjustment builds on the next. So for a lot of patients, it's like your spine's been stuck like this for 10, 15, 20 years. I adjust you, it opens it up, but your muscles want to pull you right back to where it's been stuck for a long, long time. So to fix it, it takes repetition, consistency in those areas. It also takes strengthening the muscle and rehabbing the soft tissue. All of our patients, part of your care is I give you a spinal rehab home care kit. And in that home care, you'll have several things like you use in the office. There's the wobble cushion. There's the traction that's meant to be used at home. It's like the ones in our office, but you can easily hang it over the door. And then you'll have rolls that you lay on at night to help your curves in your neck. You have body weighting where we do a chest and a head weighting similar to what you did in the office. And these are things that we give you the home care to do at home. And I see patients that do the home care, their spine gets better results and it gets better correction even quicker. And so if you want to get the best changes, I recommend you do the home care, you follow what we show you, and your body's going to see the best results with that as well too. I also work with my patients with nutrition. I find that this is a very important piece to getting healthy is what you're putting in your body. And most Americans, we are lacking good nutrition, and we're lacking a lot of key vitamins, minerals, and nutrients that help your body heal and function. So, as part of your care, I also do a nutrition starter bundle, and it helps with getting good quality nutrition, good quality nutrients, things that help to heal your joints and your tissues, help to knock out inflammation. And it just helps to accelerate that healing and those changes in your body as well, too. So, on your next visit, when you come into our office, I'm going to be mapping out your plan and we're going to be going over your x-rays with you. On average, with our patients, we typically map out around 40 visits. Every patient is different, and I can work with you individually. But what we see does get best results typically is doing the 3 times a week for 8 weeks with your adjustments, and then dropping down to twice a week for 8 weeks. That's a total of 40 visits over a 4-month time frame. And then we map out your re-exams and your re-x-rays. I do your first re-x-ray a month into care. So I want to make sure that you're getting results, that we're seeing changes, that you're happy, that we're happy, that everybody's on the right track. My goal is to get you the results and to truly get you healthy. And I want you to be happy and I want you to be seeing changes. So that first month, we do your first re-x-ray. We do a mid checkup around your 24th visit. And on that one, I look at your posture picture and we look at that. And then at the end, we do an x-ray before you would then move into your maintenance care. All of that is mapped out in your corrective care and in your plan with that as well. And I do recommend that if you value your health and you want to get the best changes, then you're going to want to commit to that full corrective plan to really correct things the best way and to see your body truly start to get better and heal, get the best results as well. And then after corrective care, I encourage patients to do what we call maintenance care. That is like wearing braces. And then after braces, if you don't, wear the retainer, your teeth go crooked again. Same thing with your spine. Corrective care fixes it, but maintenance care or wellness care is what keeps it in place. A normal adjustment in my office is $60 for your adjustments. And then if we do maintenance care, that's the easy part. I discount maintenance adjustments down to $40 because that's the easy part. That's what keeps things going good long term. And I do see that patients that have corrected their spine and maintained it, they're doing amazing. They never go backwards. They're getting healthier. Their body's staying, working as best as it can with that as well too. The last 2 pictures I want to cover with you has to do with insurance. And this specifically is from Medicare. Though you may not have Medicare, Medicare sets standards for insurance. And in this, what they've wrote in their article here is they said, what's considered medically necessary care, which typically is the type of care that your insurance is going to pay for. And they say medically necessary care, what's considered medically necessary, what's not. This is what's considered not medically necessary. They say care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is considered not medically necessary. So when we read that, it's like the insurance, they're not actually paying for what it takes to prevent your disease, promote your health, or prolong or enhance your quality of life. That's considered not medically necessary. Things that actually work on doing that, care that works on accomplishing those goals. Those are the goals that I want for my patients. I want to help you prevent disease and promote your health and prolong and enhance the quality of your body. And that's a reason why, because of our insurance and our healthcare system, is that people never get healthy. They go to the doctor and insurance pays for the drugs and the pills and the surgery, but it never pays to actually get people healthy. Just like you can't take your insurance card to Kroger and buy healthy fruits and vegetables and good quality proteins and good food, and you're not buying Doritos and Little Debbie and Mountain Dew. Insurance doesn't pay for you to buy healthy groceries. Just like a lot of times with chiropractic, it doesn't pay to really correct the problem. Especially with chiropractic, what happens is that most insurance pays for just a couple visits to kind of cover up the symptom, but not really fix the problem. And that's what happened to my patient Kelly here. If you look back at her x-rays, she did that type of care, the insurance type of care, where the reason why she went to her old chiropractors about once a month was because that's all that her insurance would pay for, was one visit a month to the chiropractor. So she did that type of care for over 10 years. And her old chiropractor saw her based on what the insurance was going to pay and not really working on fixing the problem. So doing that for 10 years and spending thousands of dollars, it's like that didn't even fix it. So with the type of care that I do in our offices, we really work on providing you the care you need and making that affordable. We have a couple different options that patients can pay for care in our office. One is we can break your care into payments throughout your plan, or I do offer the option, if you want to do a option to save a little bit of money, is we do what's called a time of service discount, which is where if you want to pay for your care, you pay for it in full. You can do cash, check, credit card, or you can do a health savings. And we do a discount for that because it makes it easy that every time you come in, you don't have to collect for your visit. Helps us to keep our costs down, and we pass that savings on to you. And there's no risk in it. If for some reason during your care you wanted to stop care, whatever visits you didn't use or x-rays you didn't get, we just write a check back to you or refund your credit card. But that's a way that we can provide care and do a little bit of a discount, or we break it into payments. We will figure out a plan to make your care affordable. My goal is to help you. And so if you want to get results and you really want to work with your body, we will map that out and we'll go over your plan and your recommendations. And I can't wait to hit the ground running and to help you get the best changes with your health and with your body. Last x-ray I'm going to cover is one of my patients and their kiddos. This is my patient, Matthew, and his neck is a negative curvature. And his spine looked that way, and he was only 8 years old. And his neck, his bone was pushing into his skull. He had asthma, he had headaches, and he had ADHD. And this is after about a month of his care in our clinic. We went up to a positive curvature, and he saw improvements in his asthma, his ADHD, and his headaches. And he started doing better in school and seeing his health change. We work with families in our clinic. We do a complimentary checkup for spouses and kids, where you can come in and get your free checkup of your x-rays to see what your spine looks like. And then we work with family plans to make care affordable. We do discounts for families. My goal is to help people get healthy and to really fix their spines. And the sooner you start, the healthier you can be for your future. And kids don't have to end up being the next generation of sick adults. We can work with their body when they're young and keep them healthy. This is my family, my husband, Josh, my son, Jonah and Jameson, and they have grown up with chiropractic, and I've seen it make a huge difference in their health. My kiddos have been adjusted from the time that they were babies. I've checked their little spines, and they've never been on an antibiotic. They've never taken a Tylenol. They've not been to the pediatrician, and no sickness. It's like, yeah, they've gotten an earache and we've adjusted it, helps the ear to drain. And we've been able to allow the body to heal itself and not go the route of antibiotics. They've had fevers, but we know that the body gives itself a fever to kill off virus and bacteria and to kind of burn up those bad things in the body. We adjust them, we let their body and that fever do its job, and their body gets healthy, it gets well. So I just encourage you. We want to be able to take care of you, and I look forward to seeing you on your next visit, giving you your next adjustment, and mapping out your plan to help you get the best results and changes.